Hello everyone, myself Momin Mohammad Qais Mohammad Aslam, and today's topic is informed consent in clinical research. So, what is informed consent? Informed consent form it is a process or a form by which a subject voluntarily confirm that he is willingness to participate in the following clinical trials, or we can say it is a document which is in written and signed by the participants or the person who are involved in the clinical trials. The main goal of informed consent form in clinical research is to aware or to give the sufficient information about the clinical research to the peoples and see whether they are ready to being or continue in the participation of clinical research or not. The process of informed consent was developed after the Nuremberg trial. So, what is Nuremberg trial? Nuremberg trials are the trials which are done by the Germany people, also known as Nazis, which are the people who goes to the different countries and make people fear to them. There are mainly some scientists who perform different experiments on the peoples without their permissions. There are different experiments like freezing experiment, malaria parasite experiments, placebo experiments, and different experiments which majorly leads to the death of the people. After the Nuremberg trial, the Nuremberg Code came into existence. Nuremberg Code came into existence, which set a different confirmatory processes that first of all. First of all, voluntary consent is essential, which means uh, before doing the clinical trials on the participants, they should take the permission from the participants whether they want to be whether they want to be in clinical research or not. Then subjects or the participants have the rights to end or continue the trials as they need. Then researcher or the physician should minimize the risk and maximize the benefits. Researcher should first done the preclinical study before going to the clinical research. The research should benefit the society. During this course, if the following ADR will be caused to the participants, the researcher should make sure that they can be cured and they should be given the proper facilities and treatment to treat the following ADR. So the informed consent form is developed after the declaration of Helsinki. The declaration of Helsinki was developed after the Tuskegee experiment. Tuskegee experiment is an experiment which was done by syphilis, which was done by the syphilis. Tuskegee experiment was conducted between 1932 to 1972, which is a study which is done on the Negros people, that is African American people, in which they want to see the progression of a syphilis disease, in which the physician make the fake promises with the peoples of Negros that they will give the proper treatment, but they do not give the treatment, because of which most of the people die. So the declaration of Helsinki came into existence, declaration of Helsinki came into existence, and along with the declaration of Helsinki, National Research Act came into existence in 1972, which says that informed consent form is compulsory for all of them. The reporting ADR which may be caused should be minimized. Then they have set the protection they have set the principles for the protection of human rights and subjects, and by doing the biomedical and behavioral research. This is all about the informed consent form. So basically we can say the informed consent form, it is a form which is taken from the participants who are involving in the clinical trials. which says that the participants are aware about all the procedures, risk and benefits of the clinical trial experiments. Thank you.